so happy with the physical setting. So that already just made things better. Saw the activities, the different facilities, and then just, spoke with the director of nursing and one of the coordinators, and just felt very comfortable with them.
Hi, I'm Agnes Stewicki, Managing Editor with Comfort Life. We're speaking with insiders from Canada's leading retirement communities and care providers to uncover insights to community lifestyle, care, culture, and leadership. This includes insights from residents, family members, and administration. This is the Comfort Life Insider Perspective.
So I would say the most important thing is the people, and how all of the staff, they're terrific, and how they interact with my dad. And honestly, don't treat him as a patient, treat him as a person who's in the next phase of his life, and which requires extra care. And but they do it just a great job. Well, there probably be a couple of stories, but uh, sometimes my dad needs a little cajoling to get moving, and mobility, which and he gets a little comfortable, and he'll sometimes tell people that he's already been out walking, and he's walked enough, and they call him out on it. They're like, we know that that's maybe not exactly true, and that you're just trying to get out of things. Or he'll pretend that he's not hearing them when they're saying something that really is for his own good, that he needs to do, like do some of his exercises. And he laughs about it, right? Because they call him out, and he knows he's been caught. So, so there is a lot of activities. They put out a calendar each week, and it's full of activities and lots of diverse things, from different levels of exercise classes, to bingo, to men's group, to gardening groups. There's lots of things for those who want to be social to do. And it's ongoing. There's concerts, there's just, I mean, during COVID, obviously, if things had to be scaled back for safety reasons, but there's more than enough activities that would keep me busy all day. So yeah, lots to do. Yeah, it's a beautiful building. It multi-level. The dining room is quite expansive. White tablecloths. You don't feel like you're in a cafeteria setting. It's all windowed. It's on ground level. It's beautiful. There's a little snack area. There's just many rooms, activity rooms, library. Lots of places and balconies where you can go out and just overlook the woodland. Like it's a beautiful, I guess in the heart of Whitby, but it's a beautiful area. So he has, it's not it's an all-in-one suite, so it doesn't have a separate bedroom. There are ones with a separate bedroom. This actually just works very well for him. It has a kitchen area if he wants to heat up something in the microwave. He's got a fridge, he's got dishes. He's got the bathroom is quite generous in space, and certainly everything with safety in mind for for people with lesser mobility. So lots of room. And he has he's in what I would call the older part of the building, because they did build on. He has this lovely window. He's got this big round window, so he's got just a beautiful vista, just really nice view. In this phase of his life, there are more medical issues. And I would say it's improved because he has a great staff, nursing staff, all of the staff that are attentive to his needs, to make sure that he's doing, I guess, making the best choices from a lifestyle perspective, not eating so many chips and cakes and other things. And he had some issues regulating a lot of things that were, I guess, exasperating some of his health issues. And so they've got those all under control because they weren't under control. And that was certainly an area of concern. Oh, for sure. So the dietary changes, if I use those as an example, have really improved his health. His weight has come down because there were too many snacks, and it was affecting his diabetes and stuff, impacting it in a pretty negative way. So they've gotten a lot of things under control. He's taking all his medication, no longer on a selective basis, but when, as required. He does fancy himself to be a bit of a doctor, right? A bit of an expert. So, and it's also put him in a much more safe environment because there are mobility issues, and he's just used to being very active and just doing everything, and wasn't recognizing that maybe some of the things that he was doing was jeopardizing his safety. So it's safer, and it's a more comfortable environment with less stress for him. So before moving to Lynde Creek, Dad had been at another assisted living facility. And so, I think everybody tries their best. I just think the people at Lynde Creek and their approach with Dad, right? There are things that they need him to do, right? Take his medication, eat certain foods. They're just able to do it with more humanity. So he's not a commodity. He's, they really develop a relationship with him, and he's really happy. I'm there when the PSW comes in the room or a nurse is coming in a room, and they've got a really good relationship. And I know that because I know my dad, and I know when my dad doesn't like somebody. And I would say, like everybody, he's got a good relationship with everyone. And he's not the most social person, but he really interacts well with the staff. Yeah, so it's improved a lot, I would say, for my sister and myself, in terms of the worry isn't there. So if situations happen, I mean, he took a fall, for example. He ended up in the hospital. They call us right away. So, but we're not worrying about what's going on. What is he doing? Is he okay? Because we know he's okay. We have very good communication with the staff. And if there is anything, at that age, a fall can happen, or other medical issues where they need more care is required. It's part of the age. But they're very good. They're very proactive in getting a hold of us, just really laying everything out, explaining what's going on. And so for me, I don't worry, because we worried a lot before in his home and then in the other place. Yeah, it was lesser degrees of worry. Certainly more worry at home when he was by himself at a time in his life when that just, other than for himself, who he thought it made sense. it didn't make sense to anyone else. And he now will say, he understands, right, that where he is, Lynde Creek is home, and he acknowledges in his own way, right, that that the care is he needs it, right, and it will help maintain or sustain this phase in his life. Um, Honestly, on the tour at Lynde Creek, we had a great tour. We went through the building, and we were just so happy with the physical setting. So that already just made things better. Saw the activities, the different facilities, and then just spoke with the director of nursing and one of the coordinators, and just felt very comfortable with them. And because of that, we knew he would be comfortable. I think for me, it's knowing. So I would say as a child, as his daughter or his daughters, making that move to this type of facility is not without emotions, right? There's a lot of guilt. There's a lot of issues that go through, but at the end of the day, you have to do what's best for your parent. And I honestly, Lynde Creek for us was, this is the right place. And not just from a physical perspective, the amenities, but really the people, because they do go out of their way to help. They'll, bring in an iPad so you can sign up and have a conversation just like we're having now, right? A face-to-face conversation, which helps make a connection because you can't always be there. And sometimes having just a phone conversation is you're missing out a lot, especially when he doesn't wear his hearing aids. So so they're always trying to do different things, and I would say it takes the worry, out of what's happening with your parents, right? You know that they're in a safe environment, that it's comfortable, right? The rooms, everything is comfortable. They encourage you to personalize it, to make it your home, because it is your home. They want you to interact with others, and they really want you to make the best of your time there. And they really do care. Yeah, the process, honestly, it feels overwhelming at the beginning, because you really don't know where to start, and there's nobody really guiding you along the way. And we were fortunate enough that we met some people along the way who just offered bits of advice on what to look for, what's important, and I'd say to people, give yourself a break. It's emotionally, it's a very tough decision. And whether people may agree with that or not, I think deep down it really is. And you want to do right, and you do the best you can. And if the first place doesn't work out the way you think it's going to, then you move on, right? You find something else that works. And just always remember, you have choice. Now, the timing of availability may not be on your side all the time, but you really have choice, and you shouldn't settle, because it's your parents. And they didn't settle for us when we were kids, so we need to pay them back. We Because he was in a different assisted living facility, we had I guess we had a reference point of things that we wanted, things that we had realized were more important. And we chose it because of the people, and it's a beautiful facility. And it's in a great spot. It's in a woodland area that I believe, if I have the history correct, was donated many, many years ago from the Wheel and Cullen family. And it was also a home, I think it was of the United Church. So it was like a seminary. And then it turned into Lynde Creek. And then after so many years, they expanded and they've built on, but it's in just a really lovely place. Like, how many retirement homes, have all of these great woodlands around them. So there's places to walk, or even if you don't want to walk, you want to sit on one of the balconies and look out, you know, lots of birds around and, little rabbits and, little animals. It's nice. Well, I guess we got to the point where Dad had another operation, and it was obvious to us that he needed a different level of care. It was not obvious to him that he needed that. And so we approached it from a couple of different ways. We looked at bringing in home care. And so we did a cost analysis on that. And we did a cost analysis on assisted living. And then we also looked realistically in terms of home care, which we had tried before. And then he'd ask people just to leave, right? So it wasn't working, but being able to do a bit of a cost analysis for him to show him the value. Also, he lived a bit remotely. So in the winter, hard to get to his place. So if there was an emergency, getting EMS out on the hills that were icy, going to be tough. And from a timing perspective, they may not make it in time. And, so that's how we looked at it for him. So we'd had this operation and he needed care. So the first part, getting him quickly in the first assisted living, was more from a rehab perspective. That's how we positioned it. And we said to him, because he needed somewhere where people could take care of him while he recovered. And what we said to him was, okay, this doesn't mean this is forever, right? This is what we were able to find in a very short period of time, because the hospital was like, okay, he needs to leave now. And they gave us really zero notice. So we had to move very, very quickly. So that was fairly stressful. So we got him in there, and we had agreed that he could go wherever he wanted, and that he would have a choice in the matter. And he settled in there, and we kept asking him, would you like something else? You're looking at something else? And he'd say no. And so we went out and did a search on our own, because we really believed that we could do better for him. Because it's not just a question of dropping him off somewhere, right? It's your parent. You've got to do right here. And so we had started our search, and on the top of our list was Lynde Creek, by far on top of our list, versus unfortunately some of the other places we went to. And we talked to him about it, and he's like, no, I'm fine. We're like, okay. And anyways, couple months, not even a couple, let's say a couple months later, he's like, I want to leave now. Right. And there was an opening. So when we did the tour, there was an opening. And we're like, okay, well, now there's not an immediate opening, right? And so it took it took a few months. It wasn't too bad, but we kept trying to tell him, it's not just about when you decide to leave, but something may not be available. So we had to go on a bit of a waiting list and had to explain that to him. But he was ready for the move, and then he did go on a tour. We just didn't think it was good to put him through too many different visits. Physically, just driving around, I mean, that's hard. And for him, sometimes the decision-making process can be overwhelming. So we wanted to narrow it down. And so he had a tour, he liked it, he met the people, he was happy. And so that's how we move forward then. We just felt comfortable. I'm not sure quite how to say that. Our shoulders dropped, right? If you think about, we're carrying all this tension and we walked in and we just went, okay. And we both said we could live here, right? You could, at some point I could end up, we could end up in that situation as well. And it was like, so I looked at it from my personal perspective in terms of I could live here. I would feel like, honestly, for me, the dining room is beautiful. Just on the main floor, just all the windows, lots of sunlight, lots of light, um, white tablecloths. You're not feeling like you're eating in a cafeteria and just have food slopped on a plate for you, right? You're treated with dignity, and you're treated, I guess, as a bit of a guest, right? You sitting down to eat is nice. And on our visit with him, when we took him there, sorry, for the tour, we sat down and had lunch with him, so we got to experience, right, the lunch menu, selecting what you want. They certainly accommodate all dietary needs, or from a religious or medical perspective. And yeah, it felt comfortable. We went out on, they have little balconies on each floor. We went out, and I've talked about the wooded area. I loved it. I was like, I could sit out here, right? I could sit out here and read. I mean, they've got a computer area. They have lots of different things going on. I probably haven't even mentioned them all, but I could see myself. He's got a pool table out, a billiard table outside his room. Yeah, uh, we don't get him out to do that often, but we have, right? Just to shoot a little pool, just have a little fun. So the process in moving Dad from assisted living to Lynde Creek was pretty good, because we'd already pared down a lot of stuff, in terms of that had to move from his home. It was pretty easy. There's paperwork that needed to be done. We had to move his doctor. They have a facility doctor, so we had to do that. Moving phones, moving some of those things. But one of the things that we did is, because he still had his home at the time, we when we moved him into the first assisted living facility, he didn't really want a lot of stuff from home. So it was a little bland, I guess, in terms of decor. So what we did when we moved him into Lynde Creek is we took care of the move. So we went in, we brought more stuff from home, pictures, different things, and we decorated. So they're like, you put up whatever you want. And so we got everything ready, his bedding, like everything ready for him. And then what we did is we physically picked him up and we took him to Lynde Creek. So the move for him was perfect. He didn't have to worry about anything. We'd taken care of everything, and we moved him into his home versus being part of the moving process, which really is not a great, it's not good for him, because then he worries about stuff. So we just moved him into his home, and that was really nice. We had, a little celebration, we had a little wine and stuff, and it was a nice way of introducing him into his room and into his home. They had a welcome basket. They had a uh, lot of people came to welcome him. The program coordinator, Shelby, was great. There was just a lot of people welcoming him right when he walked through the door, right from, Donna at reception and Lynn and Shelby, and he just, yeah, they really made him feel welcome. There are consulting services that can help you narrow things down at the beginning of the process. So maybe I would have looked at that at a little more at the beginning of the process, because it's hard to tell from a website what a place is about. Um, that's probably, I'm not sure I would really change too much. Like I didn't feel that we had really any gaffes along the way or things or really big issues. I think it's just probably the beginning of the process, which can be overwhelming because there's a lot of choice. And well, so I think there are better questions which I could ask now that I couldn't ask at the beginning. So for example, some facilities will say, that they have nursing care. So what we learned, because everybody's got their boxes, right? Nursing, yeah, we have that, we have that, we have that. So um, in my dad's case, because of his diabetes and because it had to be administered and because he is something called, he's not on the scale, it goes up, it goes down a lot. He needed someone to do the testing. So we needed a facility that had 24-hour nursing care. And a lot of places don't have that. And so that became a pretty big aha moment. Some facilities say that they're assisted living, but they're more like adult living, right? Where people are more independent or more mobile and don't require the same level of assistance. And sometimes those things aren't quite obvious until like on our tour, for example, we went to one place and it became obvious within the first couple of minutes of the conversation. The woman said, this is not the place for your dad, right? Because of the level of nursing care, the other care required. And so it's a learning process.
For more information about this community, you can visit their profile at comfortlife.ca.